Health insurers are still denying claims despite breaking state laws. I just went over this. They deny claims all the time.
All the time. Because there's no mechanism in place to punish them for doing this.
Yes.
Like, what good is a law if it doesn't have any fucking teeth?
Yeah.
It's not a law. It is. It's basically nagging. You're just legally nagging at somebody.
Hang on. I think I've got to archive this one.
Ah, ha, ha.
It did the old, you need to. Yeah.
Oh, one more step. You are not a robot.
We just can't register with every website. We are unable to register for every website. That's so let's see what happens. Some people are fighting back. I'm going to let that one. It's going to take that one a second to go through the archives process. So we'll do this one first. My $30,000 health insurance claim was denied. That I tweeted about it. The graphic is as predicted. Public shaming works, but it's also a sign of how broken the appeals process is in the U.S. healthcare industry. Now, people always cry about this shit, but guess what? Public influence is a thing. Public influence is a thing, and a lot of these companies fear bad exposure. And especially if that bad exposure mounts and builds and becomes, and social media is the new news. The lamestream media is dead. It's done. It's no longer effective at all. Hardly anybody watches it. So if you could get something like this into social media and it takes off, you get. In December 2016, I was hospitalized with severe electrolyte abnormalities that were causing fatigue, muscle cramps, and chest discomfort. That's called malnutrition, sweetie. I received care at my local hospital, which was nationally ranked both overall and treatment of endocrine conditions, and I recovered fully. A month later, my heart sank as I received a letter from Aetna informing me that the hospitalization amounting to nearly $30,000 in treatment had been deemed not medically necessary. She was dying. It was kind of necessary. The case had seemed crystal clear. My calcium level was below the critical value of 6.0. My magnesium and potassium levels were likewise below normal. This is absolutely malnutrition.
That's
fast
food right there.
That is classic malnutrition right there. Wow. I was experiencing chest discomfort and pain and was at risk of cardiac arrhythmia. What's more, I was struggling to keep oral medications down, making it more difficult to recalibrate my electrolyte levels at home. That happens, sweetie, when you eat too much fucking Burger King, okay?
Yes.
My admission was a slam dunk, endorsed by both the emergency medicine and
the endocrine physicians.
Yeah, I had a pop-up window pop up there. Sorry. Right. But in the insurer's eyes, the treatment was not necessary. I was a new political science professor, busy juggling new courses between classes. I called it and I tried to resolve the matter, but long wait times were exasperating. Instead, I tweeted my frustrations about denial and tagged the company. I did not know if they would respond, but I wanted whoever monitored the account to be made aware. To my surprise, Aetna replied, inviting me to connect with them. When I did so, they provided a social media specific email that I could contact. I explained my issue very plainly over email, saying they needed multiple days of intravenous calcium replenishment and fluids and cardiac monitoring before I could be safely discharged to go eat more Burger King and put myself back in the exact same situation.
Yep.
Soon, an Aetna staffer informed me by phone they could not see why the claim was denied, and it may have been an error. The denial was reversed before I ever saw a hospital bill. The point being exactly what I said at the beginning of this.
That was probably an AI denial.
Mm-hmm. That is exactly correct.
Let's be honest. This is the way I see AI in this particular scenario. Mm-hmm. AI is either it's on or it's off. It's black or it's white. You're not going to get gray area with
ones
AI.
And zeros, baby. Ones and zeros.
When you talk to a human being, especially one that has some life experience, and like, well, yeah, if they said it was fucking, you needed that, you need it or you'll die, then it is medically necessary.
Yeah.
Where in AI, it's like, well, fuck it.
And AI is incapable of empathy,
compassion,
sympathy, compassion,
and mercy,
or any of the other mercy or understanding.
Mm-hmm.
Anything from an AI that looks anything like that is just a simulation based solely on what the AI has seen in files, in other web pages, in papers, what have you. They're incapable of any of that. So insurance companies will argue it's the perfect tool for rejecting or approving claims, when in fact it is the worst possible tool because it cannot account for the human condition.
Correct.
Which is something like this. Now, as I said throughout that article that I just read, when I read what she had, she clearly did that to herself. Okay. Those were all the classical symptoms of malnutrition. And she's got a degree in political science, which means she has an income, and dehydration.
Yeah.
She has a degree in political science, which means she has the income, theoretically, at least, to eat like a normal person. It's not like this person is from Eritrea or Ghana, where there might be problem getting actual food.
Correct.
So this person ate herself into that hole.
Yeah.
Point blank. Yeah.
You're not wrong.
Yep.
But I mean, yeah, granted, you could be an absolute jackass with yourself, and then you walk into the hospital and everyone has to pay for your shit.
Yeah. I mean, I put myself in that situation. I'm a fat fuck right now. I am, point blank. But this morning, the You Fat Fuck dam on the river broke. And I went out and walked 5 miles hard with a sweatshirt on in 82 degrees because I know that that's how I'm going to burn the calories off. I just had to reach that point. I know that it's my responsibility. I know that I put myself here. But you get these people like this, they eat themselves into these problems.
Or they smoke. Or they
any number of things.
Yeah.
Any number of things.
I get it.
Any number of things. But they won't take responsibility for themselves. And that, I will admit, irritates the ass out of me. Denials of health insurance claims are rising and getting weirder, which is right up our alley.
Weird? No.
Yeah.
Don't make it weird, bro.
Don't make it weird, bro. Seriously. Millions of Americans in the past few years have run into this experience, filing a healthcare insurance claim that once might have been immediately paid, but instead it is just as quickly denied. If the experience and the insurer's explanation often seem arbitrary and absurd because it might be because companies appear increasingly likely to employ computer algorithms and AI, or people with little relevant experience to issue rapid-fire denials of claims. I know this to be true. Also, again, see law firm. Sometimes bundles at a time without reviewing the patient's medical chart. A job title at one company was denial nurse. It is a handy way for insurers to keep revenue high and just the sort of thing that provisions the Affordable Health Care Act were meant to prevent, because the law prohibited insurers from deploying previously profit-protecting measures, such as refusing to cover patients with pre-existing conditions. The author worried that the insurers would compensate by increasing the number of denials, which is exactly what they did. And so the law tasked the Department of Health and Human Services with monitoring denials. There's a link to the PDF in there if you're interested afterward. Both by health plans on the Obamacare marketplace and those offered through employers and insurers. It has not fulfilled this assignment. Big shock. Everybody make the face. Thus, denials have become another predictable, miserable part of the patient experience, with countless Americans unjustly being forced to pay out of pocket or faced with that prospect, foregoing needed medical help. Sometimes the insurer's denials defy not just medical standards, but also plain old human logic. Here's a sampling. This is what I wanted to get to right here. Gene Patterson of Los Angeles said he was shocked when payment was denied for a heart procedure to treat an arrhythmia, which had caused him to faint with a heart rate of 300 beats per minute. Dude, you should be dead.
Yes.
After all,
he had, it gets pretty.
That's like hummingbird speeds, man.
Yep.
After all, he had the insurer's pre-approval for the expensive $143,206 intervention. More confusing still, the denial letter said the claim had been rejected because he had asked for coverage for injections into the nerves in your spine. He had not. That were not medically needed. Oh, really? Months later, after dozens of calls and patient advocate assistance, the situation is still not resolved. Next item. An insurer's letter was sent directly to a newborn child, denying coverage for his 4th day in a neonatal intensive care unit. You are, get this. You are drinking from a bottle, the notification said, and you are breathing on your own. If only the baby could read.
Wow.
Next item. Deirdre O'Reilly's college-age son suffering a life-threatening anaphylactic allergic reaction was saved by epinephrine shots and steroids administered intravenously in a hospital emergency room. This is something that they do. His mother, utterly relieved by that news, was less pleased to be informed by the family's insurer that the treatment was not medically necessary. Guy was dying.
Yeah.
Hello.
Yeah, he was going to burn in, baby.
God, it's just insane. As it happens, O'Reilly is an intensive care physician at the University of Vermont. The worst part was not the money we owed, she said, of the $4,792 bill, which is really not that bad, but still. The worst part was that the denial letter made no sense, mostly pages of gobbledygook. She filed appeals so far without success. Some denials, of course, are well considered, and some insurers deny only 2% of claims. In my experience, it's a lot higher than that. Always, invariably, the KFF study found, but for the increase in denials and the often strange rationales offered, might be explained in part by ProPublica investigation of Cigna, an insurance giant with 170 million customers worldwide. So Cigna, let's say they're taking in anywhere from $200 to $2,000 per head per month. Do the math there. Yep. 170 million customers. And they, wow. ProPublica's investigation published in March found that an automated system called PXDX allowed Cigna medical reviewers to sign off on 50 charts in 10 seconds, presumably without examining the patient's medical records. Decades ago, insurance reviews were reserved for a tiny fraction of expensive treatments to make sure providers were not ordering with an eye on profit instead of patient needs. So it's exactly what we posited it at the beginning. I'm going to skip down here a little bit. Challenging and denial can take hours of patients' and doctors' time. Most people don't have the knowledge or stamina to take on the task unless the bill is especially large or the treatment obviously life-saving. And the process for larger claims is often fabulously complicated. The ACA clearly stated that HHS shall collect the data on denials from private health insurers and group health plans and is supposed to make that information publicly available. The data are also supposed to be available to state insurance commissioners who share with HHS the duties of oversight trying to curb abuse. Does anybody else here smell apathetic federal workers and greased pockets in the state insurance commissioners?
Or bureaucracy bitches.
I just said that, though.
I know.
I was just specific about the type.
I know. I'm just saying.
Yeah.
But it's a bureaucracy bunch of bitches doing shit like that.
Absolutely.
Now, don't get me wrong.
Absolutely.
A company stays in business when it makes money. All right?
Yeah.
But at some point, there needs to be some oversight going, wait a minute. You're denying all of these people. You have this huge amount of fucking profit. There's the laws on the books don't have any teeth, so you're not really going to get dinged for it. So what the fuck is going on here?
And I happen to know these insurance companies hire brigades of lawyers.
Yes.
To do all of this work for them. So there you have that.
Yeah, we got St. George saying, sounds like the VA disability deny everything. If you really want it, got to get it in court. Yep.
Yeah.
Yes, sirree. I've known quite a few guys that have had to take the VA to court. And usually the minute they get the paperwork, they will figure something out.
Right. It's called a settlement, and that is par for the course. But as we just pointed out, they have so much income that they don't care about this shit.
Well, the VA will usually, before it gets to that point, be like, okay, you needed this treatment, we'll give it to you now.
Yeah.
To try to avoid the settlement thing.
Mm-hmm. Yeah, exactly. Yeah, that is precisely the sort of shit they pull. I'm going to share this tab instead. Come over here, hit this button, and say Cigna Healthcare used AI to deny hundreds of thousands of valid health insurance claims, lawsuits allege.
What's the date on that?
The date on this is going to be very recent. It is July 28th, 2023.
Okay.
Cigna was already using.
Yeah.
AI really just came into public casual use the way we have it now in the last year and a half.
Well, it's been around for about 8 to 10 years.
Am
I wrong?
I worked on the first AI program overseas that was weaponized against foreign communication systems in 2000.
Oh, wow. Okay. I was way off, man.
Yeah.
Wow. All right. I stand corrected.
We've been doing this for a minute.
Yeah.
That was really cool to see too. That was really cool project. I can't go into details. Obviously, it is an older project and is probably long since mothballed. But when it showed up and they were like, "Here, make this work against this target," we're like, "Oh, this is so cool."
We can do that.
Yeah, we sucked in over 150 different data feeds in like 10 minutes. Like enemy communications networks, comms on like all kinds, because we had access to all these antennas and stuff. We just sucked in all of this communications and we're like, oh my God, we can see everything. It's crazy.
All right.
Anyway, Cigna Healthcare used AI to deny hundreds of thousands of valid health insurance claims, lawsuit alleges. After I said that, somebody in the audience's asshole puckered when they realized what we can do. A class action lawsuit has been filed in California against the insurance company Cigna, alleging that they used an algorithm to review and ultimately reject hundreds of thousands of health insurance claims filed by patients. In many cases, the doctors approved the denials without taking the time to review each individual case. I guarantee you that was true. According to the suit, this is a violation of California state law requiring insurers to carry out a thorough, fair, and objective investigation into every claim. It's only your life, after all.
Yes.
Instead of giving each case the individual attention it deserves, the company trusts its PXDX algorithm, which is an AI, which they use to help reduce their labor costs by decreasing the amount of time. So they're increasing their profit while denying hundreds of thousands of claims.
And some of those people probably died.
Absolutely.
Yeah.
Absolutely. Some of those people died. This is probably one of the most cynical articles we've read tonight. This is incredibly cynical. The suit states, relying on the PXDX system, Cigna's doctors instantly reject claims on medical grounds without ever opening patient files, leaving thousands of patients effectively without coverage and with unexpected bills. In one particularly concerning case, a California woman received an ultrasound at her doctor's orders because they suspected she could have an ovarian cancer. Although a cyst was found on her left ovary, Cigna denied the claim for both the ultrasound and a follow-up procedure on the grounds that they were not medically necessary. As a result, she had to cover the cost of these ultrasounds herself. Her situation is far from an outlier. Numerous other patients had a similar experience. According to the suit, the scope of this problem is massive. For example, over a period of 2 months in 2022, listen to this, Cigna doctors denied over 300,000 claims using this PXDX. Wow. Spending an average of just 1.2 seconds reviewing each request. In many cases, patients appealed. Roughly 80% of the appeals resulted in the initial decisions being overturned. But some people don't know that they can appeal. They don't know how to do that at all.
Or they might not have the time.
Yeah. Or the resources. Yep. That is the most cynical one we've read tonight. That is straight up just.
And here's the most insulting part here. All right. So say they do deny your claim, and the guy dies. You take him to court, and they literally reduce your life and worth to some monetary number that they get away with if they, all right, we'll cough up $2 million. We're sorry.
You're an entry in a spreadsheet. Yeah. You're literally an entry in a spreadsheet to them.
at some point, that is not going to be the answer people want to see.
At some point, healthcare CEOs are going to end up getting surprise haircuts in the street. Oh, wait.
It's already happened.
Yeah, exactly my point. Yeah. Look, again, not advocating this kind of shit. I'm just saying the conditions have been created for the inevitable to occur.
Correct. Listen, injustice only goes on for so long before people get sick of it. You can go back through all of like the small little wars in Europe, and there were thousands of them over a 500-year period.
I have a really interesting book on Eastern medieval Europe that is, there were like 130 wars in the space of 4 decades.
Yeah. But all of them revolved around injustice for the most part. Like, we're human beings. We don't handle that well, especially when it goes on to the point where you have loved ones dying because of it.
Yeah.
And can you imagine if you had a child that passed away because they were denied health insurance? You take them to court and you find out that, oh, yeah, it took 1.2 seconds to make this decision and your child's dead. Sorry, here's $5 million.
Yeah, somebody asked who the doctors were who made those decisions. It was Cigna Health Insurance.
God, I should have fucking bought some beer. God damn it.
You're not feeling... You know you've got a bunch of mead down in the basement.
I can't. I just want to punch shit. I'm getting so mad.
Watch Grunt Speak live every Tuesday and Thursday at 8 p.m. Eastern. And if you want to join Pop for Supporter Sundays, go to redonkulous.com/donate and make a monthly pledge. A link is in the Meat Gazer box.